Safis, a student nurse at Victoria University. I'm doing Bachelor's of Nursing Science. Today my presentation is about stress and coping mechanism in nursing practice. So we are going to look at, in the presentation mainly, I'm going to explain the psychological concept of stress and coping, and also demonstrate how it applies in nursing practice in improving patient care, communication and clinical decision making. So let's first understand what's stress. Well, stress, it's a psychological response, I can say. Yeah, it is a psychological and physiological. It's a psychological and physiological response to demands that exceed the body's limit. So, according to Lazarus and Goldman, 1984, that is where I mainly researched my work. For him, he says stress depends on two things. That is the primary appraisal and the secondary appraisal. What do I mean by primary appraisal? When I say primary appraisal, here I mean, is the situation threatening? And when I say secondary appraisal, it means, do I have the resources to cope? So, if we talk about coping mechanisms, these are strategies, like the strategies that people use, yeah? The strategies that people use to cope up with stress. Or, yeah, I can say those are, that is it. Types of coping. We have problem-focused coping, and we have emotion-focused coping. So when I talk about when I talk about problem-focused coping, this is what I mean. You're going to deal with the problem directly. Like, for example, you're diagnosed with diabetes, then you seek, you get information, you follow the treatment plan as by the doctor. There you're dealing directly with the stressor, which is the disease, the condition of diabetes. Then there is what we call the emotion-focused coping. Here in emotion-focused coping, you manage emotional responses, like you go for prayers, relaxation, emotional support, maybe from loved ones, yeah, something like that. That is what you are managing emotional response. So let's talk about the applications. Let's talk about the applications. What is the application of this concept that we are talking about? How is it applied in nursing? So it's used to assess patients for psychological stress. As a nurse, you assess your patient for psychological stress. Another thing, you identify ineffective coping behaviors in patients. All this, we apply this concept. It is also used to provide emotional support and reassurance to a patient. For instance, an example. For example, a 32-year-old pregnant mother is being admitted, something worrying, has anxiety, is crying. Then, as a nurse, you come in and try to reassure her. You explain to her in detail the condition that she's facing. Take for instance, this mother is having preeclampsia. That is the reason for her admission. She's pregnant, and maybe she's in her third trimester, pregnant. You explain to her in detail, you reassure her, you even maybe give her the breathing exercises. Then you find this mother has calmed down. So that is another application. So another one is, it is also used in therapeutic communication to reduce anxiety, and also it's used in the support of families under what? Under pressure. Also, it's used to educate the patients, educate patients about the healthy coping strategies, all that. So let's talk about what does this stress management? Oh, stress management as a nurse, it improves treatment treatment adherence. Someone is able to adhere to the treatment, and also patient's cooperation. Thirdly, recovery outcomes. So all these help us in what? This is all because of stress management. So let me give another example, like clinical example. You find that in these examples, they all have all the two mechanisms of coping, all types of coping, like the problem focus and the emotional focus. Take for instance, a 32-year-old mother who is admitted on ward because of prolonged labor. And this mother is restless. Being restless, the other thing, you see that this mother has shown fear. So, as you, a nurse, she reports to you of her anxiety. Then, what you do, you assess the stress levels of this mother. Secondly, you reassure her. You provide, you ask her if she needs maybe a companion, a birth companion. Do you need your husband maybe to be with you, your mother-in-law to be with you? It's like, please, maybe my mother-in-law. Then you even you tell her about the breathing exercise or techniques. At the end of it all, you see this mother calming down. She cooperates during the process of delivery. So all these are helping us in what? In another example is a newly diagnosed patient with HIV, and this patient shows fear, denial. Then as a nurse, you provide counseling and then refer the client for psychosocial support. All these are the clinical examples and case study that I can give. So in conclusion, this is what I can say. Stress and coping are all important. They are all important. Stress and coping mechanisms are all important in the nursing practice. And as a nurse, knowing how patients perceive stress, it helps you to give what? Holistic care. This holistic care is going to address both physical and psychological cases altogether. So it improves physical and psychological needs. Effective coping support improves patients' comfort. It also improves patients' cooperation and the overall health outcomes. Yeah. So this is my reference that is shown in the writing where I got all this information from. Thank you so much. Thanks for listening.